Okay, hello everyone. Okay, today we finish our unit 17. Level 12 of soul is healthcare and family fine. Okay, in this video we will study about healthcare, physical rehabilitation services, and provincial healthcare system, and healthcare training. So what is going to be at that time? Okay, before we start, let's go to our category first. The first one is integrate. Combine one thing with another to form whole. We can say unite, combine, merge, or join, make something to be one, right? In Khmer, very good. So you can say transport planning should be integrated with energy policy. In other words, amputation, the action of surgically cutting off the limb. We can say when you have a problem with your leg or your arm, so you cut it off in Khmer. Yeah, very good. Yeah. Example here, genuine may appear and make amputation necessary. Now what is arthritis? A disease causing painful inflammation or stiffness of the joint. You can say when you have a disease with your joint, you cannot move it very easily. It's not only smooth or moving. In Thai, what does it mean? Yes, example here, some people with paralysis develop an inflammation of the joint known as psoriatic arthritis. Another word is paraplegia, paralysis of leg and lower body, typically caused by spinal injury disease. You can say when you have the disease that you cannot move, right? Just like your spine or your leg or your arm, you cannot move. It is the paralysis in Khmer. Yeah, very good. Example, early onset paraplegia developed during the active phase of infection. Another word is leprosy, a contagious disease that affects the skin, mucous membrane, and a nerve, causing discoloration and lump on the skin, and severe cases, disfigure and deformity. We can say the disease that made yourself from the old generation to another generation have a lump in your body. In Khmer, what does it mean? Very good, right? So it spread to your next generation, right? It spread. It's not go to another, but with your next generation it will. We have now, but we are little, right? We are little. Example here, the most severe form of the leprosy produce like disfigure, motile, or lump. Number is meningitis. It's serious disease in which there is inflammation of the meninges caused by viral or bacterial infection, and marked by intense headache and fever, sensitivity to the light, muscular rigidity. We can say the disease, when you have the disease, that means you can die, right? Because of some happen to your brain. You don't have something to cover your brain. In the past, some prime minister, right, is died because that, but now we have the vaccination to work against that disease. In Khmer, what does it mean, that disease? Yeah, very good. Example, it is the disease, right? When you think a lot, you will have meningitis. Okay, example here, but it is believed viral meningitis in its mildest form is often mistaken for flu. Another word is limb. An arm or leg of person, or four-legged animal, or bird, or wing. You can say this is your limb, right? Your arm or your leg. In Khmer, what does it mean? Okay. Yeah, very good. Example here, they go out stretching their cramped limb. Okay. So another word is a therapist. A person skilled in a particular kind of therapy. You can say healer, psychologist, or advisor. The person that cure someone, just like the doctor, right? In Khmer, what does it mean? Yeah, it's not like doctor. Doctor is it's modern, right? But therapist is sometimes they do with the person that have the problem with their moving. Another word is infirmary, hospital, right? You can say they are a clinic. You never see it, but it is frequently word we use. So what does it mean, right? Yeah, clinic, example here, all were epidemic patient on the statistics at the infirmary. Okay, now the last one is recruit. Is enroll someone as a member or worker in an organization or as a supporter of a cause. We can say enlist or enroll. When you enroll, you make at least someone that is a new one, just like a new student, a new worker. So what does it mean? Recruit. Yeah, it's my example here. They are planned to recruit more staff later this year. Okay, we summary about that. Now summary, verb is summarize. Okay, so the three main points that we're going to do. The first one is physical rehabilitation services. Okay, so what is physical rehabilitation services? The percentage of population with physical disability is high due to physical disability, right? They cannot move. Were injury at that time and landing. Landing we have a lot right, at that time, and also were injury because were after Pol Pot regime. And Khmer Rouge at that time we still have in the jungle in some area. Number of performing amputation have been growing because of amputation. We have there cutting off the limb. Arthritis, we have the back problem, hemiplegia, paraplegia, leprosy, polio. Okay, so this is the reason that they have the amputation. Okay, the national rehabilitation treat those problems. Okay. It is also provide appropriate technology, artificial limb, and adaptive equipment. So they have artificial limb, right, to replace. If you don't have artificial limb, you cannot walk because you amputate. Physical therapists have been trained in 1987 School of Nursing. So they, so they, so the nursing at that time. In 1987, they trained right nursing at the time, and provincial health care program. You can go. It's okay, but continue. Provincial healthcare system in 1990. There were 29 provincial hospitals, 157 district hospitals, and 1,025 town infirmary in Cambodia. So we have only maybe nearly 2,000 right for hospital in province and in Cambodia at that time. Okay, there were some problem in medical care during their time, which was some problem that we met. Shortage of trained health personnel, electricity in the province, and major problem malaria and war injury, mainly amputation. Okay, the last one is healthcare training. In 1979, none of the 19 professors from medical school in Phnom Penh remains there. Only 19 you see at that time, only 19 professors. And there are few doctors with experience in planning and management. 1989, Ministry of Healthcare restored medical faculty. Okay, you can go, right? Okay, it's okay. And the healthcare training system has been restored from the top down. The first priority was medical doctor in Phnom Penh, and the doctor nurse were set out in the province. The training was more on quality than quantity, and on road learning. Students take note, memorize, and test on facts. So they have a little human resource, right? So they just need quantity, not quality, right? Because we lack of them. The doctor at that time only 19. Integration, problem solving, service, clinic experience are minimal. Education is based on a curative model and trend based in hospital. Okay, and the language of instruction in the Faculty of Medicine before were French and Khmer at that time, right? Just like in School of Medicine nowadays, if we have only French and Khmer, but private it have English. In the past, no, only French. Currently, there is Khmer only instruction as well, only Khmer also. Some students were sent abroad on the training. Okay, so that's all for today. Anything more you can ask me, okay, thank you.